my name is Austin Dorrity. I feel very privileged to have been asked by St Anne's Hospice to deliver a brief presentation contributing to the recognition of their 50-year anniversary. This presentation will look at diagnostic overshadowing, why it happens and how it can be prevented. Reflection and challenging practice helps promote equitable healthcare for all. Diagnostic shadowing means that we have missed something and made assumptions and attributions by not looking at the full picture. This means that we can miss underlying health conditions. This can contribute to misdiagnosis, poorer health outcomes, and avoidable deaths. So what happens? So symptoms of physical ill health are mistakenly attributed to either a mental health, behavioural problem, or as being inherent to the person's learning disabilities. Imagine someone with learning disabilities and or autism is sat in the corner of the room banging their head. Often people in this situation will see the person and experience fear, and this person is already less likely to be approached if someone is fearful of them, and this therefore creates inequalities in healthcare. We recognise the learning disability and attribute the person's behaviour or presentation to their learning disability or autism. This overshadows the consideration that there might be an underlying physical health problem. It gets missed. It doesn't get treated. People with learning disabilities have much higher risk of experience a variety of diseases and conditions, and it's vital that physiological and pathological determinants and behaviour change are explored. If they are not, people with learning disabilities can suffer poor care and avoidable deaths may even occur. So why does it happen? What we do know is that not all health professions have knowledge and experience of learning disabilities, autism and neurodiversity. And with that becomes the lack of knowledge, but also that's where the fear kicks in of situations that they're scared of. And that fear causes the fight or flight, and we end up avoiding interactions with the person because we might find their presentation or behaviours threatening. Unfortunately, we can sometimes find it difficult to tell other people, our colleagues, our managers, that we feel scared or threatened, and especially when it is our job, which we are doing. People have prejudices and often hold negative attitudes towards people with learning disabilities and autism. We may not always recognise our own prejudices, but they can have a serious impact on our practice. We may also recognise them in others, and it's certainly our job to challenge and support people in recognising how their prejudices may impact on the care and treatment they deliver. Negative attribution can follow someone. It might be that someone has expressed their views on someone, and this has followed the person, clouding other people's assumptions and objective assessments of that person. Empathy. There are challenges to developing empathy. Difficulties in establishing connections with people can make empathy challenging. We make connections with people by finding similarities in things we have in common, our perceptions and how we understand and relate to the world around us. Objective assessment relies on our ability to relate to the person and understand their own reference base and perspective. Pain assessment can often be a particular challenge, as people may not express pain in a way which we relate to ourselves. Just because someone is not vocalizing their pain or displaying expressions we associate with pain means that we can often miss it. If someone says they are in pain, believe them and validate it. A guy that I had the privilege of working with attended A&E on many occasions saying that he was in pain. Unfortunately, he was not believed, as it did not look like he was in pain. he became seen as an attention seeker, and this was attributed to his learning disability. It was also suggested that he liked the nurses examining him and touching him. Significant gastrointestinal problems were not identified, and this caused him significant ill health. The environment can be really frightening for people. Think about, situations where you're anxious and how your behaviour changes. Feeling unwell and being in an unfamiliar place can make us feel anxious. For some people with a learning disability, this can be very challenging. We also know that people with learning disabilities, neurodiversity, can really find it hard in kind of identifying, describing and naming their emotions. And when we're asking people how they feel, maybe that they're unable to identify those feelings and name them. Equality in healthcare. We are all unique. The world looks different. Our perceptions, tolerances, and expressions differ. Understanding the person and developing empathy allows us to make appropriate adjustments. Do not treat everyone the same. Promote equality through the recognition of difference and adapt practice and approaches to achieve equitable outcomes. Thank you very much for listening.